Hello, I'm Leggy Ballesteros, a PA from San Antonio, Texas, with over 18 years of experience. I practice internal medicine and obesity medicine at Gonzaga Medical Group, and I've received the Obesity Management in Primary Care Certificate and the Certificate of Advanced Education in Obesity Medicine. I'm excited to talk with you today about some important topics in obesity care. To get started, we'll focus on the goals of obesity management. Then, we'll have several videos discussing some of the current medications available to our patients and how to individualize their care. We'll wrap up this series by discussing how to educate our patients and set expectations for using pharmacotherapy in managing their obesity. As many of us are aware, obesity is a chronic disease associated with a number of comorbidities and complications, many of which can have a severe impact in a patient's quality of life and overall health. Obesity impacts nearly every organ system, as you can see in this image. This means that when we treat obesity, we're not just treating one condition, but we have a real opportunity to impact a number of outcomes for our patients. What's interesting is that even a 5 to 10% reduction in body weight can have a meaningful impact of some obesity-related health conditions. However, other comorbidities require a larger reduction in body weight. The higher the body weight reduction, the more significant the impact on one's health has shown to be. As clinicians, we need to remember to consider our patients' obesity when treating their chronic health conditions. This will help us establish appropriate goals and determine the metrics we want to use to include our assessment for improving their overall health and individualizing their treatment plans. Years of preclinical and clinical data, as well as working with patients, has shown us that lifestyle change is a critical component for obesity management. For most patients, it is insufficient as a single approach for long-term, substantial weight reduction. So, what does individualized treatment look like? Well, we should take a couple of things into consideration. These include whether they're on any obesogenic medications, whether they have other health disorders that could worsen their obesity or comorbidities, and any environmental, psychological, or behavioral factors. Let's say we have a patient, Anna, a 42-year-old Hispanic female with obesity stage 1. She's a single mom of 3 with a full-time sedentary job at a call center. Anna's labs confirmed a hemoglobin A1C of a 6.1%, higher than her last reading of a 5.8%. In this situation, our first instinct is to prevent Anna from developing diabetes. In doing so, we must evaluate her obesity simultaneously when addressing her prediabetes. For Anna, a reduction of a body weight of 5 to 10% may be sufficient to positively impact her hemoglobin A1C and avoid developing diabetes. Hence, obesity management may be the first and hopefully the only necessary treatment for her current condition. While discussing a treatment plan, we need to assess her outside influences, such as her sedentary job, her schedule as a single parent, cultural influences, as well as financial circumstances. We could then discuss a proper nutrition plan, adjusting her habits and obesity medications to provide us with that body weight reduction of a 5 to 10%. In comparison, let's consider another patient, Mark, a 52-year-old Caucasian male with obesity stage 2 and uncontrolled hypertension, despite the chronic use of metoprolol and hydrochlorothiazide. He thought the elevated blood pressure was attributed to his anxiety, but he's been on paroxetine for years for it. As clinicians, we know that reducing his hypertension markedly reduces the risk of congestive heart failure, stroke, and chronic kidney disease. Patients with significant hypertension may need to actually reduce their body weight upwards of 15 to 25% to see their blood pressure return to within normal range. For Mark, the goal of treatment is actually different than for Anna, and therefore the treatment itself may be different. In discussing options with Mark, we should consider adjusting obesogenic medications and modifying nutritional intake to help create a healthier weight. We should also discuss adding an obesity medication to achieve the needed obesity weight reduction. We'll dive into choosing appropriate treatments in our upcoming video. I hope this video helps you see the importance of considering comorbidities and complications of obesity when individualizing treatment plans. It's important to consider quality of life, management of obesity complications, and long-term weight management, in addition to our considerations about the initial weight reduction. In our next video, we'll discuss some of the pharmacotherapy options available to help our patients meet their goals. I hope you can join me.